Welcome back, and I'm here with Dr. Irfan Alladin, and before the break we were talking about minimally invasive spine surgery. I would like you to take a look at a recent Channel 12 News feature that goes behind the scenes and looks at the motivations of greedy lawyers and dishonest patients moments after a car accident occurs.
If you're in a car accident, your phone may ring non-stop with clinics and car shops wanting to help you out. And waiting in the wings, a lawyer.
After her car wreck, Altagracia Mena got a phone call.
This is such and such from the doctor's office. And she said, and we happen to have an opening today.
A hidden camera then shows how the doctor's office sent a van to pick her up. But this wasn't arranged by her insurance or the other drivers. Most likely, people hoping to profit from her pain got her number from a police report. It's legal for doctors to call victims. As for lawyers,
it is very illegal. It is a felony.
But Bill Edwards says to get around that law, some lawyers work with doctors to get clients. He says this kind of ambulance chasing hurts victims.
It hurts people to whom clients are like a piece of meat in the meat market.
They do not get adequate compensation for their injuries or their economic loss.
Lawyers already have billboards targeting accident victims. There are phone book ads and ads on the internet. Advertising like that is legal, but a lawyer calling you, visiting, or soliciting directly isn't. It's called barratry, and it's hard to prosecute. Back in the van, Talk Indeed turns to lawyers.
Who do y'all normally refer to as far as the lawyers?
Two local law firms were named on the way to this chiropractic clinic where Mena was examined, but she knew something wasn't right and got other help. Meanwhile, P.J. Freeman says he was called to this clinic after an accident and was also examined.
As soon as that was over with, in comes the lawyer. They promised that everything was going to be taken care of, that we had nothing to worry about.
He too went someplace else. Money is the cause of all of this, and the accident victims are left behind.
Now, Dr. Alladin, we talked before the break about the professional battles that have been going on in the field of spine, and the media has talked about the spine turf wars. But this difference of opinion as to who can and cannot perform certain procedures is one of the factors that plays into what are referred to in the United States as frivolous medical malpractice lawsuits, where patients will bring legal actions against doctors that don't really have any medical or legal merit.
Right.
And as rising healthcare costs have been addressed in the US, one of the factors has been the issue of frivolous medical malpractice lawsuits and the cost that they contribute to the healthcare system. And there are some estimates that it totals almost $60 billion a year annually.
That's right.
What do you think can be done to address what some people see as a bit of an epidemic within healthcare in the US?
I think limits have to be imposed. While a person who is injured should have a lawful right to a certain recompense, these extreme, and as you mentioned, frivolous lawsuits are destroying our healthcare system. And other countries of the world where it is not practiced as such, their costs are much lower. Now with the Affordable Health Care Act, Obamacare, this has totally been neglected. Nobody has taken to issue the malpractice premiums that we pay. If you ask me as a physician to take my malpractice premium and give it towards health care for those who cannot afford it, I would much rather they have it than some attorneys who are taking millions of dollars themselves out of the system, and as you mentioned, 60 billion perhaps in total.
But that's a very interesting point that you bring up about the fact that Obamacare, or the Affordable Health Care Act, it did not take the opportunity for medical malpractice reform. It let that go. And some people say that it was politics and the trial lawyers made sure that their cash cow, as some people call it.
Lawyers are much more powerful than doctors, or they're better connected than we are. And that's why the physicians, and more importantly, patients are hurt. So many people cannot afford insurance because of these frivolous lawsuits that you mentioned.
Do you think that frivolous medical malpractice lawsuits work against medical innovation?
Absolutely. Physicians will be less likely to try newer, more advanced techniques if they are always under this fear that they may be sued.
Now, when we look at healthcare from a global perspective, the United States for many years was seen around the world as a place where innovation occurred.
That's right.
But within the last 10 to 15 years, other parts of the world have started to move ahead.
That's right.
India, China,
That's
parts
right.
of South America. Do you think that the constant threat of frivolous lawsuits in America has frightened physicians from innovating?
Absolutely. I think physicians took this risk in the past because while the frivolous lawsuits were there and malpractice premiums were high, they have grown. Our reimbursement rates have shrunk. So now the reason to take a risk has been taken away from a physician. If the risk is very high, the compensation is low. It's better off if we try this in India, in Dubai, and China, and other countries of the world, try these new medical techniques, and that is what is happening. Some of our most talented physicians are not practicing here anymore.
And when one looks at the history of medicine, some of the greatest innovative steps have happened when physicians have tried new techniques.
Absolutely, absolutely. And then these other practices which favor the insurances, where when a patient receives a check that instead of going to the physician, it goes to the patient, and then they steal that check. Then when the physician tries to, which by law they must do, retrieve that, then the patient will file a frivolous malpractice suit, just in order to keep that.
But this is a uniquely American
Yes,
issue.
absolutely. The UK, France, Germany, you'll never see this there.
So what do you think needs to happen? What solutions do you think can be implemented in addition to the caps to lower the impact that frivolous medical malpractice actions have on the healthcare system?
Right. Obviously, the first thing is to limit the caps. But after that, I think that if the amount that or the percentage that the attorneys would keep would be brought to, let's say, 5% or 10%, I think you'd see less motivation for an attorney to go after a patient to start up one of these frivolous malpractice suits.
So there has to be legal reform.
Legal reform, absolutely. Legal reform.
Yeah.
And then in addition, as far as the, if research or the guidelines should be such that if a patient understands the risks, they should be able to try new advanced techniques, and it should not fall back on the physician.
Now, you mentioned before about patients who have been genuinely hurt or harmed
Yes.
as a consequence of medical mistakes, and the fact that it is proper that they have access to compensation.
That's right.
But patients and lawyers in America shouldn't have the financial incentives that currently exist.
That's right. These incentives make it a field day for them. They would love to get more and more patients to file frivolous malpractice suits in order only to coat their own coffers.
Okay, well, Dr. Alladin, I'd like to thank you for coming on to the show today and for talking about an area of healthcare that at the moment doesn't seem to have any clear answers to it, but there's definitely a lot of discussion going on about it.
Thank you for having me.
Thank you.